What are some once lethal conditions or diseases that can now be cured or managed to the point where they are relatively harmless? HIV. In the 80s, it was basically a death sentence. Now many people with proper treatment live long enough to argue about taxes and back pain like everyone else. Tuberculosis. It used to be called a consumption, and was responsible for nearly a quarter of all deaths in Europe at one point. It was also likely the inspiration for the Edgar Allan Poe story *The Mask of the Red Death*. Cholera. You don't die from the disease. You die from dehydration from the massive diarrhea it causes. It's a fairly short-lived infection, so as long as you keep drinking, and have salt and carbs to replace lost electrolytes, you'll be fine. The bubonic plague that wiped out a quarter to half of Europe in the Middle Ages can be successfully treated with modern antibiotics if it's caught in time. Rh disease, which causes a mother's immune system to attack a fetus's blood cells, used to cause 10,000 annual miscarriages and stillbirths in the US alone, and now is prevented with a series of shots. Hepatitis C. When I became a pharmacist, a bit over a decade ago, it was very difficult to cure. The treatment failed often, and the side effects were awful. Now you can take an 8-week course of pills and be cured forever. It also has had a downstream effect of a lot more organs being cleared for transplant, because even if it's infected, we will transplant the patient and then treat them of the hepatitis C. So far, it's the biggest medical advancement of my career. It's truly incredible. Most amazing thing I've seen so far is cystic fibrosis. Pretty much a death sentence, but with gene therapy, they can now live to their 60s. Type 1 diabetes, with the discovery of insulin. Scarlet fever. 1901. My great-grandmother lost 3 daughters to it over 2 months. 2007. My daughter got it. I freaked out. Doctor laughed at me and gave her a week's antibiotics. Well, it used to be measles and mumps until dumbass mager arseholes did their research here and fucked things up for everyone. Appendicitis. Before surgery, a burst appendix was life-threatening. Today it's a routine operation with near 100% survival rate. Leprosy is still around, spread by armadillos among other things, but can be treated with antibiotics. Well, not exactly a harmless, but cancer research has come a long way in my lifetime. It used to basically be a death sentence to be diagnosed with cancer, but now, certain types are very treatable. A lot of infections can now be easily cured with penicillin. AIDS. Cervical cancer. Australia. HPV vaccine. Not totally wiped out, but it is on track to become the first country to eliminate it by 2035. Yersinia pestis. The bacteria that causes the bubonic plague. It caused several pandemics that killed up to 60% of the population of Europe. Today, it's much less common due to modern sanitation practices and can be cured using antibiotics. It still has about a 10% mortality rate with treatment, but it's much less dangerous now than it used to be. Just everyday run-of-the-mill cuts. Before antibiotics, any minor scratch could get infected and kill you. It wasn't likely, but it wasn't impossible. Also, I would have died during my birth and probably taken my mom with me without modern medicine. I was an emergency C-section. Many women died in childbirth before modern medicine. Pernicious anemia. It was literally called pernicious because you would become so anemic you would die. For example, it's used for drama in Downton Abbey as a scare that a character might die. Now I just take sublingual B12 supplements, and I've never actually been anemic. Diabetes. Used to be a death sentence, now it gets managed with insulin, tiny sensors, and people arguing with bread. Polio. We saved Mitch McConnell just to get stuck with their stupid anti-vax bullshit. Hydrocephalus. Yes, it requires a shunt, but it's become so advanced you only need to once or only a few times in your life. Food-borne illness of all kinds. Milk used to spread TB. Poorly processed meat could cause trichinosis. Poorly handled food could cause salmonella, Bacillus cereus, etc. Pasteurization of milk was one of the first food safety interventions, and while foodborne illness isn't gone thanks to humans being stupid, it is greatly reduced. Having an abnormal pregnancy, preeclampsia, placenta previa, needing a C-section. The other thing is being born premature. The kids that did live usually had health problems for life. 15 years ago my friend gave birth at 25 weeks. The kid is in high school, perfect health. Strep throat. People used to die from rheumatic fever and other complications of untreated strep throat. Now we have a quick throat test and you take 10 days of a bubblegum medicine, amoxicillin, and you're good. SMAHT1 hemophilia multiple myeloma, debatable, HAE cystic fibrosis. Smallpox was fully eradicated about 50 years ago. It infamously killed a very large number of Native Americans who were introduced to it by Europeans. It's the best-known example of an infectious disease being not only curable but does not even happen anymore. Cystic fibrosis. It's not relatively harmless now, but the life expectancy for people with CF has skyrocketed in the last few decades. There are incredible advances in medications and therapies that allow them to now live quite normal, long lives. Prior to the late 1940s, children with celiac disease would often essentially die of malnutrition, even if they were eating enough. The autoimmune response destroyed their small intestine and made it impossible for them to absorb enough calories and nutrients. No one knew why. Now, we know that the immune response is triggered by ingesting gluten, so as long as celiacs stick to a strict gluten-free diet, we're healthy. Vitamin K deficiency bleeding in infants. I don't know a ton about it, but I know a simple shot of vitamin K for an infant to help their blood clot. I saw that there is an increase in the number of people denying the shot for their newborn because of the increase in anti-vaxxers. Syphilis used to be lethal and now you just take antibiotics. Hemophilia. Before factor 8 and 9 treatments were synthesized and used to treat hemophiliac patients, most children did not live past the age of 10. Now with proper safety precautions, access to blood transfusions and lifestyle management, people with hemophilia can live full and long lives, often well into their 60s. I hope that one day rabies will be curable in people with symptoms. Hydrocephalus is one that always blows me away. I worked in a specialized facility in the early 2000s where I saw a few cases of it in people who were born in the 60s and managed to survive. My friend's son was born with it a few years ago and seeing him as a normal walking, talking little boy now just floors me. Within 2 generations they developed a surgery that just completely cured it. Scurvy. People were in bad shape or dying on long sea voyages from lack of vitamin C. The things we fortify anything vaguely fruit-flavored with. The same somewhat goes for other nutrients deficiency disorders, folate-related neural tube defects, rickets, iodine-related goiter, etc., but scurvy stands out most to me. Plus how many other diseases do we share with just apes and guinea pigs?